I'm Dr. Cary Cole-Anthony, family physician at Grand Itasca. I see a wide variety of patients in my practice, anything from newborns through elderly patients and everything in between. Stress is a normal response to external stimuli. It can be anything from being worried about giving a public address to a bunch of people. It could be being in a dangerous situation where you're confronted by an angry bear in the woods. It could be being worried about a test. It could be anything that causes you to be worried or anxious. Stress is a normal physiologic response to these stimuli. It can be something like having some tachycardia, which is a faster heart rate. It could be sweaty palms. But it could also be something more serious like difficulty sleeping. It could be affecting your mood, making you more depressed, or having anxiety that interferes with your ability to do your normal day-to-day routines, interacting with people at work or at home or in other personal situations. So there are some very simple things that you could do to deal with stress. It could be journaling. It could be exercising, it could be meditating, praying, talking to family or friends. It could be a variety of different things. It's basically what we refer to as self-care, doing the things that you need to do to try to take care of yourself so that you can manage your stress on your own. If you don't take care of your stress and keep it bottled up inside of you, it tends to come out in some way that tends to be unfavorable at some point. It might be a chronic anxiety issue or depression. It could manifest itself as a substance use disorder. It could interfere your ability to interact with the people you know and love, and create stresses in the relationships with them. So if you are constantly avoiding issues, it just tends to build and build and build until it becomes unmanageable, and it really interferes with your life and your ability to cope with things. I think women, as caregivers, tend to carry possibly more stress than men do. Certainly men can have stress in their lives too, but women tend to be mothers, they tend to be wives, they can be working outside the home. They carry a lot of responsibilities on their shoulders, and trying to manage many different things at one time can sometimes be very difficult. And because of that, we often aren't taking the care and time to take care of ourselves, and then it becomes harder to manage. If you notice that you're having difficulty sleeping at night, if you feel so much anxiety and depression that you can't think of leaving the house, you don't want to do the things that normally would make you happy, you can't get out of bed in the morning, anything like that where you feel like your day-to-day routine is disrupted, you should consider seeing your healthcare provider to discuss this further. There are medications that can be used. Counseling can be very helpful. There are multiple different ways that you can seek help. As a parent, we want to take care of our children, and it's very hard when we see our kids that are stressed and trying to navigate difficult situations. Things to watch for as signs that your child might be having difficulty would be more isolation. Your child's spending more time in their rooms, not wanting to interact with family, not wanting to interact with friends. They don't seem to get excited about things that would normally make them happy, like playing with certain toys or certain playmates. Given the circumstances right now with the COVID-19 epidemic, this is adding a lot more stress for folks and kids in particular with navigating a new school situation or schooling from home. So if you notice that your child's having issues that you're concerned about, you certainly should contact your healthcare provider, your child's healthcare provider. I think having an open communication with your child, making sure they know that if there's anything that's bothering them or worrying them, that they can come and talk to mom and dad, trying to get them outside to play to anything that distracts them a bit is always a good thing, but always just being persistent. If there's something that really worries you that is going on with your child, trying to always let your child know that you care about them and you want the best for them, and you are a listening ear open to hearing what they have to say. Grand Itasca Clinic and Hospital, your partner in health.